With Lucky Land Slots, you can get lucky just about anywhere.
Dearly beloved, we are gathered here today to... Has anyone seen the bride and groom?
Sorry, we're here. We were getting lucky in the limo and we lost track of time.
No, Lucky Land Casino, with cash prizes that add up quicker than a guest registry.
In that case, I pronounce you lucky.
Play for free at LuckyLandSlots.com. Daily bonuses are waiting. No purchase necessary. Void where prohibited by law. 18 plus. Terms and conditions apply. See website for details.
O'Reilly. You've got questions? O'Reilly Auto Parts has answers. Need a pro you can trust? We've got that too. No matter what you need, our professional parts people have the training and expertise to help you do things right. Deep automotive knowledge. Just one part that makes O'Reilly stand apart. The professional parts people. O'Reilly Auto Parts.
Hi everyone, I'm Deb Flashenberg. Welcome to Yoga, Birth, Babies, a podcast produced by Prenatal Yoga Center. We will be diving into everything prenatal yoga, birth, and baby related, hoping to inspire, educate, and empower you through your journey into motherhood. Thank you for listening. Hi, I'm Deb Flashenberg. I am your host of Yoga Birth Babies, and today we're talking about Group B Strep. What is it? How often do people have it? What do you do if you have it while you're pregnant? What do you do if you have it during labor? How might this affect your baby? So we answer all those questions and more. For this conversation, I have Dr. Tara Randis on. Let me tell you a little bit about her. Dr. Tara Randis is an associate professor of pediatrics and molecular medicine at the University of South Florida and chief of the Division of Neonatology. She's an active member of the Society of Pediatric Research, American Pediatric Society, and the Perinatal Research Society. Dr. Randis is also on the board of directors of Group B Strep International. She handles this information so well and offers it in a way that is easily digestible and not scary and conversational. So I think any pregnant person, any new parent, this is going to speak to your needs for Group B Strep because every pregnant person gets tested for this. So it's something that we want to understand well. Before we get to that conversation, I just wanted to say I have seen an uptick in the downloads of our free downloadable. So it's called 5 Simple Solutions to the Most Common Pregnancy Pains. Now, I really should change the title to Pregnancy and Postpartum because this downloadable can help anybody, pregnant or postpartum. So head to our website, PrenatalYogaCenter.com, download it, and then just have that available for the days that you can't get to class, but maybe your upper back and neck are hurting, or your lower back, or your hips. And within a few minutes, a couple asanas, this can help alleviate some of that discomfort. So please enjoy. I also want to say thank you for those that are leaving rating interviews. It is really helpful for people finding the podcast. And if you're listening to the podcast, I'm hoping that you're getting what you need from it and that others can enjoy it as well. So if you wouldn't mind taking a moment and leaving a rating and review, it would really mean a lot to me. So thank you in advance for that. And then the last thing I want to mention before we jump into the conversation with Dr. Randis is a little bit about our teacher training. So you've probably heard me talking about it. We have an 85-hour prenatal yoga teacher training. So if you've got any sense of me from the podcast, you know that I love evidence-based information. I like to peel away the layers and really look deep at the topic. And that's what we do in our teacher training. So if you're a yoga teacher and you want to best serve the perinatal community, this training can give you those skills. How can you support someone during pregnancy? How can you help their aches and pains during pregnancy? How can you offer childbirth education in ways that we can easily digest and then continue to help empower people to make choices about their body, about their birth, about their way of parenting. So if any of this resonates with you, head to our website, PrenatalYogaCenter.com, and check out our teacher training. Okay, we're going to take a super quick break, and when we come back, please enjoy my conversation with Dr. Randis.
With Lucky Land Slots, you can get lucky just about anywhere.
Dearly beloved, we are gathered here today to... Has anyone seen the bride and groom?
Sorry, we're here. We were getting lucky in the limo and we lost track of time.
No, Lucky Land Casino, with cash prizes that add up quicker than a guest registry.
In that case, I pronounce you lucky.
Play for free at LuckyLandSlots.com. Daily bonuses are waiting. No purchase necessary. Void where prohibited by law. 18 plus. Terms and conditions apply. See website for details.
Hi, Tara. How are you?
I'm great. Thank you. How are you doing today?
I'm doing great. I'm excited to jump into this topic because I have to admit, in all the years I've been working in the perinatal world, I haven't really jumped into this topic. I know when I had my kids, all I was worried about is being GBS negative. When I was a doula, I'm like, okay, they need antibiotics, but I hadn't really had a lot of deep discovery until someone asked me more about it. And I thought, oh, well, this is a good podcast because I don't know much about it. So I'm excited and thank you. Thank you for.
Well, I'm so glad you're excited.
I'm such a dork this way. Like, I love science for someone that hasn't taken a science course probably since the 10th grade, but this will be fun.
Well, we're going to have a great conversation.
So I guess before we get too deep into this, I'd love to learn a little bit about you and how you came to focus on neonatology and become one of the board directors of the Group B Strep International.
Sure. So I started my medical training and really recognized early on that I loved pediatrics. That was a very easy decision for me. It was a good fit, but I really enjoyed caring for infants and newborns. But I also enjoyed my rotations in obstetrics. So I was really interested in pregnancy and childbirth, and neonatology really just offered the perfect crossroads of those two things. So once I completed my pediatrics training, I did some further training to become a neonatologist, and it's just been wonderful. It's really been the perfect blend of all of those things together. And I do spend about half of my professional time in the laboratory, and I study perinatal infections. And when you're talking about perinatal infections, Group B Strep is at the top of the list. So while I spend half my time caring for patients, the rest of my time is in the laboratory trying to understand how GBS causes infections and hopefully discover ways that we can prevent those. And through that work, I really came to know some of the other members of the board of Group B Strep International and really was quite fortunate and delighted to be asked to join that group.
Yeah, it's a wonderful website, and I know you guys do wonderful work, and it's very exciting that I had a chance to speak with someone from there. So I guess let's go to the very basics for those that are hearing that, and they're like, what is this Group B Strep she speaks of? How do you describe that?
Yeah, absolutely. So Group B Strep is a bacteria, and it's all over. It's a commonly found in our gastrointestinal and our genitourinary tracts, and in fact, it's actually found in some animals too. We know it's in cows, it's in some fish, so it's all over. But 25% of us are colonized with Group B Strep, meaning it's a part of the microbial community that lives in our body. And for the vast majority of us, it never causes a problem. In those of us in those individuals that are vulnerable though, because of their age, so elderly individuals or the very young, like infants, or in people that are immune compromised, or pregnant, it can cause serious problems. So really, we don't talk about it a lot outside of pregnancy and newborns because it's all around us and it really causes problems.
I didn't even know that it could affect older people. It really, in my world, was just about being pregnant, getting a culture at 36 weeks. If they have it, someone has antibiotics throughout their labor. So I didn't realize how abundant it is. And how it affects.
So older individuals or anyone with some compromise in their immune system. So individuals with diabetes, for example, can be at higher risk for infections with Group B Strep, but it is pretty rare in adults. And really the focus is during pregnancy and early infancy.
So let's go into that. So I was scouring your website researching to prepare for this. And what I didn't know is that babies can get infected during pregnancy. So I know that if someone shows up Group B Strep, they have antibiotics during labor. What is someone doing if they find out there's Group B Strep during pregnancy to help the baby?
That's a really good question. So, if you've heard of Group B Strep or like you're saying, you've had a child before, were pregnant, the focus is often around the time of delivery. And really, that's because we actually have some strategies to prevent disease caused by GBS that is acquired during the time of delivery. But unfortunately, because GBS is around in many of us, it can cause some infections in utero. It can cause something called chorioamnionitis, which is really just an infection of the sac around the baby. And in some cases, it can actually cause stillbirth. So we know that globally, GBS is an important, a leading cause of stillbirth. So the troubling thing is we don't have any strategies to prevent that right now. And really, ultimately, the goal is for the development of a GBS vaccine, because that would be the way that we could potentially combat some of those really unfortunate pregnancy outcomes. Because right now we don't have anything for that type of infection. And
so then, what happens if someone finds out they have it while pregnant? I mean, is that just, it feels like a stressor on the pregnant person?
Right. Of course, right. Having some information and not having any tools to know what to do or even what to look for. So, if you're pregnant, at any time, whether you're GBS colonized or not, and you're not feeling well, if you have a fever, or maybe perhaps you've been feeling the baby moving and then you haven't for some time. If there's any changes, I think it's really just important to listen to your body, trust your instincts. And if you're not feeling well, reach out to your obstetric provider. They often will have you come in and do an exam, and they can look for signs or symptoms that there might be an infection in utero. So really, it's about trusting your instincts and taking care of yourself and paying attention to when you're not feeling well when you're pregnant.
So if there are signs, and maybe I'll ask you to go through those signs a little more in detail, but if there's signs that they're not feeling well and they get tested and they are GBS positive, would someone go on antibiotics during their pregnancy?
That could happen. That's a good question. So that really, we're talking about chorioamnionitis or an intrauterine infection. So some women do get admitted and hospitalized because there's concern for an intrauterine infection, and that can be caused by GBS or other bacteria or even viruses. And often those women may have a fever, or they may have some abdominal tenderness on their exam. The obstetrician might order some blood tests, and they might have a high white blood cell count or other signs of infection. And if that's the case, those women can get some antibiotics for that and really close monitoring.
Okay. I also while I was searching your website, I saw that they recommended getting a GBS test during the first prenatal, during a urine exam or urine sample. I had no idea that was part of the protocol. So if somebody now listens to this and they're early in their pregnancy and they go see their care provider and like, I would like a urine analysis to see if I have GBS. How do you think the care provider is going to react to that request?
Yeah, that's a good question. And I think that, oftentimes a urine culture is done as part of routine prenatal care. And that urine culture really is not to just look for GBS. It's there to look for a variety of things that can happen. There's a lot of other bacteria that can cause urinary tract infections. There's some signs in urine tests, like some protein or maybe some red or white blood cells, that there may be some other things going on. So your obstetrical provider is sending that for a variety of reasons, not just to screen for GBS. So you might get a little bit of a funny look if you ask for it that way. But I think the point is really that if you have a urine test early in your pregnancy and Group B Strep is found to be growing in that urine culture, the important thing is that's a sign that you're heavily colonized with GBS. And so it's really important to know your colonization status. And we'll talk about it. Typically the protocol is to screen at 36 or 37 weeks of pregnancy for that. But if you have urinary tract infection at any time during your pregnancy, maybe there was one detected during that first prenatal visit where GBS is growing in that urine culture, then you can know from that time going forward that you have some GBS colonization. And that's something that we're going to have to pay attention to when it's time for your baby to be delivered.
Okay. So could somebody test negative at one time and then positive at another?
So that is possible. We know from a lot of epidemiologic studies that screening for Group B Strep in women that are pregnant at 36 or 37 weeks of pregnancy. If you screen positive, that's a great predictor that you're going to be colonized with Group B Strep at the time of your delivery. And that's really what's most important. It's the fact that you are colonized with Group B Strep at the time of your delivery, because that's often how it's transmitted to a newborn. And so we don't want to wait until a woman comes in labor to figure out if she's GBS colonized or not. So the next best option we have is screening at 36 weeks, or 36 to 37 weeks of gestation. So you asked, is it possible to be negative then and be positive later? Yes, it is. And that can happen really for one of two reasons. The first reason could be that the test wasn't done correctly. Fortunately, that's rare, but we're human and testing procedures and protocols are not always perfect. So it can be really a false negative. And the other thing to know is that colonization can be what we call dynamic, meaning it can come and go. It can be heavy. It can be light. So it is true that you could truly be negative at 36 weeks of gestation and then be positive later on. And that can happen in a small proportion of individuals. But right now, the best screening we have is at 36 to 37 weeks of pregnancy, and it is a very good predictor of your status at the time of delivery.
So for those that haven't had kids and they're hearing like, oh, this screening at 36 weeks, what is that? Can you talk about how it's done?
Yeah, sure. So it's a pretty simple and quick test. Basically, your provider takes a swab and inserts it into the vagina and also into the rectum. And that swab then is placed in a special tube and sent to the laboratory. And we look to see if GBS grows. That's the most traditional way that we do this type of testing. Basically, it's a culture of GBS. We look for that living bacteria in that culture. And over the past several years, that process has been refined, meaning that the chance of a false negative has become smaller and smaller because we have great media to transport that specimen, and we have better procedures in the microbiology labs to really detect GBS. So that's really happening much more efficiently than it has. The other way that it can be done, and sometimes this is done if, for example, a mom comes in preterm labor, or for whatever reason, she was unable to be screened at 36 or 37 weeks of gestation. There's a more rapid molecular-based test that can be done that doesn't really involve growing the bacteria in the lab, but instead identifying Group B Strep by its DNA.
Okay. I didn't know about that one. So I've heard some really wacky stories about how students are like, okay, I want to make sure I'm negative. So the two that really stick out in my mind, because one of them, I just have an image. So one of my students told me she took a
I know where you're going with this.
You know where I'm going with this. She took a garlic
I know where you're
clove.
going with this.
Okay, so for those that don't, they were like, where is she going with this? They took a garlic clove. In theory, I'm like, oh, that's interesting. And she made a hole in the garlic clove. I'm not sure how, but there was a hole made in the garlic clove. I don't know where the string came from, but there's some sort of string put into the hole in the garlic clove. And then she made like a garlic tampon. I don't know how long it was up there. I don't know, but I do know she then told me when she went to pull it out, the string broke and her husband had to go get the garlic clove. So that's one. And then I've also heard from one of my students, actually she's one of our teachers, and she said she did like a Greek yogurt douche. And I'm like, that must have been so messy. So those are the two that really just seared in my brain. I'm sure there's probably others you may have heard of. Is there, first of all, is that where you were thinking I was going with that one? The garlic?
I knew exactly where you're going with that. I knew exactly where you're going.
So why garlic?
Question,
why garlic? What is it about garlic that people, or yogurt?
Well, yeah, I mean, there are some natural foods that have some antibacterial properties.
It's like
and
the
I
probiotic.
think
is that they were thinking?
Yeah, that is where, I mean, certainly yogurt we know has some other bacteria, some probiotics that can be beneficial. And I think that's where some of those practices came from.
Are they legit?
But it's really important to know that there are no home remedies. Garlic, yogurt that have been proven safe or effective in reducing GBS disease. And I understand that, obviously there's a lot of concern about the use of antibiotics and the effects that it can have in your body and how it affects the other bacteria that are there. And certainly those are legitimate concerns. However, in the case of GBS colonization, the only way that has been proven safe and effective to reduce your risk and your baby's risk for GBS infection is antibiotics. So,
all right. So friends
until
out
we have
there,
a vaccine, we should focus. Yeah, we should really focus on antibiotics because they are safe and they are extraordinarily effective. And there's been a lot of studies on some of these home remedies, and they are not proven to be effective. And I'll give you one statistic that I like. So, if a pregnant woman tests positive for GBS and receives antibiotics during labor, there's only a 1 in 4,000 chance of delivering a baby who would develop GBS disease. So it's a pretty low chance. I wish it were 0, but it's not, but it's a very low chance. If she does not receive antibiotics during labor, her chance of delivering a baby with GBS is 1 in 200.
Wow.
So the antibiotics work really well. If you are colonized with GBS, you're colonized. And the most important thing is to really know your status and know that you're colonized and know that when your baby's going to be delivered, antibiotics are really effective in reducing transmission to the baby. And there's really not much you can do during pregnancy to change your status by home remedies.
I'm really, really glad that we got that out of the way because I know people, and I'm there too. I'm a type A. Like I want to be able to do something if I know there's, an issue. So right. I'm very glad that we did address that because I don't want people thinking, okay, I can resolve this because they can't.
Sure. I mean, I think that's a natural instinct, right? You know something, you hear that it can be risky to you or your unborn child and you want to fix it. But really, it's important to know that we do have something. We have a very effective strategy that can protect babies.
All right. When we come back, I know you gave a few signs of GBS, but if we can go a little bit more into that, all the things people should be aware of, we'll be right back. Okay, we are back. So what are some of the signs that I think you said fever and just kind of feeling crummy. What else might someone want to look out for that they might have GBS?
Lucky Land Casino asking people, what's the weirdest place you've gotten lucky?
Lucky? In line at the deli, I guess?
Aha, in my dentist's office. More than once, actually.
Do I have to say?
Yes, you do.
In the car before my kids' PTA meeting.
Really?
Yes.
Excuse me, what's the weirdest place you've gotten lucky?
I never win and tell.
Well, there you have it. You can get lucky anywhere, playing at LuckyLandSlots.com. Play for free right now. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18+. Terms and conditions apply. See website for details.
This episode is made possible by PYC. A robot may not be coming for your job, but competitors are coming for your market share. At PYC, we pair the right tech with the right solutions to help you gain a competitive edge. Reimagine operations from the cloud, fuel innovation with responsible AI, and detect risks before they become headlines. That's human-led and tech-powered. It's all part of the new equation. Learn more at thenewequation.com.
Sure. Well, I mean, just important to note that the vast majority of women that have GBS colonization are just that, colonized. So they're not sick. It's part of their normal body flora, and it's unlikely to cause any problems. In the rare cases where a pregnant woman is colonized with GBS and it can ascend up into the uterus and cause infection there, we're looking for things that we mentioned earlier, like a fever or generally not feeling well. And if that's the case, really, you do need to call your OB so you could have a full exam and evaluation. If there's any concern for infection there, they might admit you to receive some antibiotics. But the vast majority of times, this is just a normal part of you. And unfortunately, it could be a risk to your baby, but very often you're going to feel completely fine. Now, in a newborn, there can be some really telling signs. It's important to realize that newborns with infection don't often have a fever. They may have a fever, and of course, a fever can be concerning, but they can really show some other signs. So a newborn might be fussy, might appear extra sleepy or lethargic. They're not feeding well. sometimes they're making some grunting or groaning noises when they're breathing, or could have some color changes. And so if anyone were to see any of those signs or symptoms in their baby, it's so important that you call your pediatrician immediately, or go to an emergency room for an evaluation, because babies are different than older children. They may not, spike a fever, and may have some more subtle signs to look for.
So those are the signs that they could be sick, but what would GBS do to a newborn? How does it affect their bodies?
Yeah, that's a great question. So Group B Strep can cause a bloodstream infection in a neonate, right? So that just means that there's GBS circulating in their blood. Sometimes it can be found in the lungs. It can cause pneumonia. It's a leading cause of meningitis, which is an infection around the brain and spinal cord. So obviously that's a very concerning type of manifestation. In some babies, GBS can cause a skin or soft tissue infection, a joint infection. And it's really important to note that in medicine, we talk about GBS in neonates presenting in two different ways. So there's early onset GBS, and that's GBS that occurs in the first week of life, soon after a baby's born. In fact, most of it occurs in the first day of life. And then there's something called late onset GBS. And these are babies that are born and look absolutely fine, are often discharged home from the hospital or birthing center with their families, and then get sick after that first week of life. And those are the babies that may have some more subtle things like a skin or joint infections, or some grunting when they're breathing, or just some lethargy. So it can cause a whole host of problems in a newborn. And really, I always tell moms and dads and caregivers to trust your instincts. If the baby's not acting well or acting differently, there's really no harm in calling your pediatrician, or if you're very concerned, bringing them in for a good look and making sure that it's nothing serious.
It was interesting when I was doing teacher training, because I teach a lot of prenatal yoga teachers how to teach prenatal yoga. In one of our sessions, we had someone that had just had her baby, and we also had an L&D nurse. So it kind of went into a deeper conversation. And one of them said that I can't remember if it was the L&D nurse or the person that just had a baby. Somebody was saying that their hospital's protocol was not to do antibiotics, but to do an observation of the baby. And I thought that's so interesting, because I've only worked in the New York hospitals where the protocol was always start, antibiotics at least 2 rounds, 4 hours apart. Have you heard have that changed over the years? Have you heard of people just doing more of an observation? Because what you're saying is it could show up right then and there, or it could be a week or two later.
So that's a good question. So just we'll be clear. So for a mom that has GBS colonization, that we know is GBS colonized, or that has a urine culture early in pregnancy positive for GBS, or a mom that had a baby in a past pregnancy that was affected by GBS, all of those moms should receive antibiotics during labor. So then the next question is what to do about the baby that's been exposed, right? So that baby was born to a mom that did not get antibiotics in time. Maybe she labored really quickly, or maybe the baby was born preterm, or for whatever reason, that baby was exposed and we didn't have the benefit of that antibiotic treatment during labor and delivery. So yeah, things have really evolved. And when I did my training, the recommendation was that all those babies were treated. If there was any concern for intrauterine infection, or there was even Group B Strep that was not adequately treated by giving antibiotics to mom during delivery, often those babies got antibiotics, even if they looked fine. And so what's happened in the recent decades is that because screening practices have become so routine, and moms are getting screened, and moms are often getting antibiotics and are upset colleagues are doing such a great job of keeping an eye out for infections. What we do now is if a baby's been exposed but otherwise looks well, we can observe that baby. So, that's not a baby that we would discharge early, but that's a baby that we could watch very closely in the hospital for any signs and symptoms. And that kind of goes to that idea of balancing antibiotic exposure, right? Because we know that antibiotics have their risks and have their benefits. So we know that if a baby looks healthy and we can do serial observations, that the risk of infection is actually quite low. So many of us have moved to observing those babies. However, that doesn't apply to a kiddo that, of course, has a fever, or a baby that appears fussy or extra sleepy or is not feeding well or has any real changes. Those could be signs for sepsis. And if those babies are exposed, then antibiotic treatment is the right way to go.
If the birthing parent has GBS, baby and doesn't have time to get antibiotics, instead of just giving, that's shifted. I like hearing that. Instead of just shifting to baby gets antibiotics, now it's a watch and see. So does that parent then get sent home with the list of okay, we're watching and seeing, everything looks good. Let's check in a week and make sure baby's still looking good? I'm guessing there's follow-up.
So the risk really for delivering a baby let me reword that. So the risk really is in a baby that has been exposed to GBS with inadequate treatment, meaning they didn't get antibiotics in time or they delivered early. Those babies, if they stay well for the first 48 hours of life, the risk that they would develop early onset sepsis is actually very, very low. So, we send those babies home with the same instructions we do for all babies, that, GBS is not the one we're talking about today, but it's not the only cause of infection. Babies can develop all sorts of things. And so we send everybody home with the same sort of watchful guidance to trust your instincts, to watch your baby closely, and if something changes, to give your pediatrician a call, just to have a really low threshold to reach out if you have any concerns. GBS that occurs later, that late onset GBS that I mentioned, antibiotics during delivery really does not change the risk for that, unfortunately. We don't have any strategies right now to prevent late onset GBS. Babies that present with late onset GBS may have acquired GBS at the time of delivery. That's quite common, but they also might acquire it from their environment or other caregivers. And the risk is still there, and it's not really changed by giving moms antibiotics. So in those cases, it's just the same guidance that we give for all babies is keep your pediatrician appointments. If something changes, if your baby's not looking well or you're feeling like something's off, go ahead and reach out and give us a call.
So I'm going to back up a little bit to thinking about the whole someone's pregnant, they are GBS. So I want to go into a little bit about pregnancy and then a little bit about the labor process. So can you explain why someone should not have, if they have GBS positive, they should not have their membrane stripped to stimulate labor? Why is that?
Yeah, that's a great question. And that's something that's been studied for a long time. And I think there's some mixed data about that, but really that stems from the concern that there might be some, bacterial seeding, meaning some spread of some bacteria that's found there in the vaginal tract during the procedure of membrane stripping, really, which is, done by an OB or a midwife or a doula when you're trying to hasten labor. And manipulation of the membranes can hypothetically cause some bacteria to get in there. And if a mom's colonized with GBS, that could increase the risk. Now, the evidence is limited. If you look at the American College of Obstetrics website, they say that the data are inconclusive and we're not really sure if it's been associated. And then there's been other studies to show that it is associated. And I think that the most important data, or the most important takeaway message for women is to, one, know your status, know if you're colonized with GBS or not. And if there is, consideration of membrane sweeping or stripping to stimulate labor, to really talk to your provider about the potential risks and benefits of that. It may be best just to wait until labor occurs and not increase any risk for translocation of GBS during that procedure.
Yeah, it's. I can imagine when someone's right around their due date, they're like, "I want to get this baby out. Do what you got to do." But I like your idea of like maybe it's a wait and see. Wait to see if labor can start before having to head up in there and try to strip those membranes.
And there's absolutely, and there's nothing we do that really doesn't have a risk and benefit to consider. And I think that really talking to your provider and exploring those potential risks and benefits of anything we do during pregnancy or labor is really a worthwhile conversation.
So let's also talk about someone finds out, okay, know my status, GBS positive, they head into labor. So we've been talking antibiotics, and I would love just to, if you can explain a little bit more how the antibiotics are given, the protocol, how far apart, how long they should have. There you go.
Yeah.
Go.
That's a great question. So if you know that you're positive for GBS, your obstetrician or your provider has done a screening test and you're a GBS carrier, the first thing is don't panic. I think, pregnancy can be really anxiety inducing. And, the goal here is not to cause extra anxiety. It's to know that, we have this information and we have something that we can do about it, which is really, really important. So if you are a carrier for GBS and you're going into labor, you are going to it is recommended that you get some intravenous antibiotics prior to delivery. Those antibiotics are safe and have a long history of use. They're most often penicillin or ampicillin. If there's an allergy, there are some women that are allergic to penicillin. There's some alternatives, some cephalosporins that can be used. But those are the antibiotics that we know are safe and effective in preventing early onset disease. And so if a woman is a carrier and she presents in labor, the obstetrician is going to start those antibiotics right away. Sometimes things happen very quickly. So you might be rolling in and your baby's delivering and you don't have time to get that on board. So that gets to your question about how often or how frequently. So we really would like to know that antibiotics are, like we say, on board, like you've received antibiotics 4 hours before your baby is delivered. That was sort of the traditional teaching. And now we know that even maybe at least 2 hours is pretty good. So the longer they're on board, at least 2 hours is beneficial. And the reason it's beneficial is not because it's going to get rid of your colonization. Remember, GBS is a part of you. It's a part of your body. It's going to be there. There are not antibiotics that you can give during labor that's going to change your colonization status. Those antibiotics can maybe decrease the amount of GBS that's present there in your vaginal tract for your delivery. And that can be helpful, but that decrease is really transient. GBS is going to come back and continue to colonize you, and you'll be just fine with that likely. But what it really does is it gets, the antibiotic goes to your baby. And so it basically bolsters your baby so that your baby has circulating penicillin or ampicillin at the time of delivery. So that if GBS, if they come in contact with GBS and it tries to get into their bloodstream, they have sort of a circulating level of that antibiotic that can protect them from invasive infection. So that's how it really works. If you're not so lucky that your labor tends to be very long, and we know it can be a long process, and that dose of antibiotics is repeated every 4 hours, depending on the antibiotic that's being used, until you do deliver.
Now, you were talking about the baby going through the vaginal canal. What about for a cesarean birth?
Yeah, that's a great question. So actually, if you are having a cesarean delivery and your membranes are not ruptured and you're not in labor, then they don't administer intrapartum antibiotic prophylaxis. That's sort of the fancy name for giving antibiotics prior to your delivery, because the baby is not going to be traveling through the vaginal canal. And have that opportunity to encounter GBS. Now, if you do have some labor prior to your C-section, maybe you're having a C-section because you had one before and you come in labor, or if you have a rupture of membranes prior to your C-section, then theoretically your baby can be exposed to GBS. And in those instances, prophylaxis is indicated, meaning mom should receive some antibiotics.
I love it. You're answering so many questions. All right. So I have one final question. We're going to take a quick break, but when we come back, if you can offer one tip or piece of advice you'd like to offer new and expectant parents, and it can be anything that you want to share. We'll be right back.
Lucky Land Casino, asking people, what's the weirdest place you've gotten lucky?
Lucky? In line at the deli, I guess?
Aha, in my dentist's office. More than once, actually.
Do I have to say?
Yes, you do.
In the car before my kids' PTA meeting.
Really?
Yes.
Excuse me, what's the weirdest place you've gotten lucky?
I never win and tell.
Well, there you have it. You can get lucky anywhere, playing at LuckyLandSlots.com. Play for free right now. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18+. Terms and conditions apply. See website for details.
Okay, so this can be anything that you feel that you want new and expectant parents to walk away with. What would that be?
Well, I think it's true for GBS, but it's true for all things parenting. I'm a parent, and I know it's hard. It's hard to know, and I think we often question ourselves. And I think that the most important thing is to trust your instincts. We are all amazing advocates for our children. We should be advocates for ourselves. And I think if you trust your instinct, your baby's not acting well or not acting right, seek attention. Don't be worried about reaching out. Don't be worried about calling your pediatrician late at night. The worst thing that can happen is you get reassurance that your baby's absolutely fine. The best thing that could happen actually is that you could potentially save your baby's life. And I've seen that time and time again. A mom or dad or a caregiver recognizes that the baby is not acting themselves and seeks medical attention. And that really can mean all the difference in the world. And so that's true for GBS, but I think it's true for parenting in general. All sorts of things that can occur during early childhood. Really, your baby best. And trust your instincts.
Yes. Oh, I love that. And I love that you did say that's for everything, because as parents, you're right, we know our kids the best. We know the subtle nuances that someone else may not see. So that's great advice. That's
absolutely true.
Yeah. Where can people find your work?
Sure. So I'll refer everybody to the Group B Strep International website. It's groupbstrepinternational.org. And there are links there to all of us that are involved in this wonderful organization. There are some stories from parents who have been their lives have been affected by GBS that really have some inspirational stories to share and help others that might be affected by this. There's a lot of information about current research that's going on out there. This organization really brings together a whole bunch of scientists all over the world that are working to develop new strategies to prevent GBS. And so there's a lot of information there and links to all of our bios and our work.
Oh, that is so great. And I really appreciate your time in explaining this, because we hear about it. All pregnant people are going to hear about it, but it's nice to understand what this is and what to look out for. And then also just kind of taking the stigma away of like, oh, I have GBS. So many people do. I think you said 25% of people do. So that's important. Well, thank you so much for your time.
It's been my pleasure talking to you. I really enjoyed it.
Thank you.
This has been an episode of Yoga Birth Babies, produced by Prenatal Yoga Center. You can catch us on Facebook, Twitter, Instagram, and Periscope. I'm Deb Flaschenberg. Thanks for listening.